Hi everybody, I'm Dr. David Reath, and I'm here to discuss this week's Truthometer Tuesday question. We tried to address one of the questions that people said they wanted to hear about when we inquired several weeks ago. So we asked about breast implants and mammograms and breast self-examination. And what I said was that placing breast implants either over the pectoralis muscle, the chest muscle, or under the chest muscle will not interfere with breast self-examination or mammography. And generally the answer is true. We had a lot of good responses and a lot of good points were made. But when there's a conception that you have to have implants underneath the muscle for mammograms to work well, and that's generally not totally true. For the first part, even when you have a breast implant under the muscle, because of the shape of the breast and where the muscle lies, only about half of the implant is covered by the muscle. The rest of it is to the side of the muscle. So even in a submuscular placement of an implant, a lot is directly under the breast tissue. Now, it is important to let mammographers know that you have implants. Certainly they will know after they start taking the mammograms, and occasionally they want to do an additional view. I have had a completely divided opinion from radiologists about whether going on top of the muscle or under the muscle makes any difference. So I'm going to say probably it doesn't. Probably the bigger issue here is to make sure that the breast is soft such that it can be compressed and the breast tissue can be pulled away and placed in the mammogram device. Now, the other interesting thing is about breast self-examination, and actually implants make breast self-examination easier because you have a smooth surface over which you are trying to feel the breast tissue rather than trying to feel your breast tissue on top of the rib cage, which has natural hollows and firm places because of the underlying ribs. So that's definitely true that there's no effect on breast self-examination, and in fact it makes it easier. So this is obviously a good question to ask, a lot of very thoughtful responses. Thank you for sharing with us. If you are interested, we also have recently posted a blog about things you can do basically to maintain your breast implants, the shape of the breast, the look of the breast over your lifetime. So check that out and we'll give you a link to that. But let's find out who this week's winner is. Gina Webster. Gina, congratulations. You're this week's winner. We have a $100 gift card for you, perfect for Christmas shopping. So come on by, pick that up. And for everyone else, thanks for playing. We'll have another question next week.
If you're a mam or a gram, say yes I am. Then get yourself a